can you explain us more about fat transfer?
So fat transfer falls into two different versions. The fat can be taken from a person's own body, and this could be very small amounts of fat to very big amounts of fat. Or it can be taken from a donor tissue, which is very small amounts. That's generally reserved for people who are suffering from some irregularity after breast tissue augmentation, or from people who want a little bit more volume or correction to their faces. That's the donor fat, which has limited applications. We have used it here at Xeno Clinic, and I have extensively used it back in the United States with good results and success. But for practicality purposes, we are focusing on the fat taken from the person's own body. And these can be taken from anywhere in the body.
Anywhere?
Anywhere in the body. Anywhere that the person has a little bit of excess, we can take it out. This can be from arms, this can be from, in case of ladies, this could be from the back, where some older ladies can get a little bulge around the bra. This can be from the stomach, from love handles, inner thighs, outer thighs, around the knees, anywhere there is a little bit of excess. Even in cases of people who have double chin, we can take that fat and possibly put it back in the face. And this can be done for the face, this can be done for the back of hands. A lot of people, when they get older, they get skinny on their hands. You get veins that are prominent in the back of hands, just like my hands, as well as some tendons that show on the back of hands. And that's one of the best results that we see with the hands. And of course, with the face, a lot of people lose the amount of tissue and the volume in the face with aging. Then again, other places that can be done, it could be used for breasts, and it could be used for buttock augmentation. For the back part of mostly ladies that want the bigger back part, as well as some intimate parts of the human body, we can use the fat.
Okay, thank you. ចា៎នេះខ្ញុំបានសួរតកតងជាមួយនឹងការផ្ទេរខ្លាញ់ ឧបមាថាអ្នកទាំងអស់គ្នាមានរូបរាងដែលជាមានក្បាលពួរធំ ឬក៏មានកផ្លូវធំ ឬក៏មានគល់ដៃធំ ប៉ុន្តែអ្នកទាំងអស់គ្នាមានមុខផលឬនិយាយទៅគឺកន្លែងដែលមានខ្លាញ់ច្រើនហ្នឹងយកមកផ្ទេរចូលកន្លែងដែលអត់សូវមានខ្លាញ់អញ្ចឹងនេះខ្ញុំសួរថាតើកន្លែងណាដែលយើងអាចធ្វើការផ្ទេរខ្លាញ់បានលោកគ្រូពេទ្យនិយាយថាគ្រប់ទីកន្លែងទាំងអស់អ្នកទាំងអស់គ្នាអាចផ្ទេរខ្លាញ់ពីពោះពីខ្នងចាយកមកដាក់ចាក់នៅក្នុងមុខឬចាក់សូម្បីតែចាក់នៅលើប្រអប់ដៃអ្នកខ្លះគាត់អាយុច្រើនទៅគាត់មានប្រអប់ដៃដែលមានស្បែកជ្រួញជ្រួញឬក៏ឃើញសរសៃពេញហ្នឹងណាគឺគាត់អាចបូមខ្លាញ់ខ្លួនគាត់ផ្ទាល់តែម្ដងយកមកចាក់នៅលើប្រអប់ដៃហ្នឹងដើម្បីឃើញប្រអប់ដៃសាឡូនកំពុងអីចឹងទៅហើយមានអ្នកខ្លះហ្នឹងគឺបូមខ្លាញ់ច្រើនតែម្ដងពីក្បាលពោះយកមកចាក់នៅលើដើមទ្រូងឬក៏ចាក់នៅលើត្រគាកចាអរគុណច្រើនមែនតើអញ្ចឹងនេះខ្ញុំចង់សួរចំនួនតបទៀតថាតើខ្លាញ់ដែលយើងធ្វើការផ្ទេរហ្នឹងគឺនៅបានរយៈពេលប៉ុន្មាន So doctor, how long does the fat last?
So it follows the behavioral pattern of the donor area. The donor fat that's taken from donor tissue is somewhat independent of that rule, because it's very condensed, it's very concentrated. It really doesn't matter or fluctuate with tissue, with weight fluctuations. If somebody loses weight or gains weight, it really doesn't affect it. But for bigger volumes, such as breast or such as buttocks, that depends on post-procedure care. That's very important for the survival of the fat, as well as the behavioral pattern of the donor area. So, for example, if somebody gets breast augmentation with fat, and they undergo significant weight loss, and they lose 5 kilos or 10 kilos, so does the breast tissue, because it follows the fat that comes from somewhere else, from the stomach, from the arms, from anywhere else that they have. So if they lose the fat, they also get shrinkage of the breast tissue, which is now mostly the donor fat. And if they gain weight, so does the recipient area, which undergoes the same changes. As far as the longevity of one injection, there is still a little bit of variability in the result of the fat transfer. Depending on many different factors, we see a lasting result of the fat transfer anywhere between 50 to 90% survival rate of the fat. there are times that we have to do a second procedure of fat transfer to make it to the volume that we want and to make it last. Otherwise, after the fat transfer, it undergoes the aging process like everything else in the human body. Generally speaking, if somebody wants to have a touch-up, it's recommended anywhere between 5 to 10 years after the procedure.
Okay, ចា៎នេះខ្ញុំបានសួរថាតើការដែលយើងទេខ្លាញ់ហ្នឹងណាគឺអាចនៅបានរយៈពេលប៉ុន្មានគឺលោកគ្រូពេទ្យនិយាយថារយៈពេលហ្នឹងគឺអត់សំខាន់ទេតែសំខាន់ទៅលើការញ៉ាំក៏ដូចជាការនិយាយទៅទម្ងន់របស់មនុស្សម្នាក់ៗដែលគាត់បានទេខ្លាញ់ហើយអ្នកខ្លះគាត់ឡើងទម្ងន់ក៏ធ្វើឲ្យចាមានផលប៉ះពាល់ទៅដល់ខ្លាញ់ដែលគាត់បានទេទៅហ្នឹងបើស្រកទម្ងន់វិញគឺអ្វីដែលសំខាន់ហ្នឹងគឺកន្លែងមុខដូចដែលយើងបានចាក់តិចដូចជាមុខក្រោមភ្នែកឬក៏គៀនមាត់អីហ្នឹងគឺមិនសូវមានការផ្លាស់ប្ដូរទេទោះបីជាអ្នកឡើងឬក៏ស្រកទម្ងន់ប៉ុន្តែសម្រាប់ការផ្ទេរខ្លាញ់ច្រើនដូចជាដើមទ្រូងឬក៏ត្រគាកប្រសិនជាការផ្លាស់ប្ដូរទម្ងន់របស់លោកអ្នកកើតឡើងការផ្លាស់ប្ដូររូបរាងនៅក្នុងការផ្ទេរខ្លាញ់ក៏អាចមានដែរប៉ុន្តែប្រសិនបើអ្នកទាំងអស់គ្នាគឺជាអ្នកដែលមានការរក្សានៅរូបរាងបានល្អគឺលោកគ្រូពេទ្យនិយាយថាអ្នកទាំងអស់គ្នាអាចធ្វើការ touch up បានមានអ្នកចាក់ម្ដងទៀតបានបើសិនជាមិនពេញចិត្តប៉ុន្តែនឹងធ្វើនៅក្រោយពេលដែលយើងធ្លាប់ធ្វើលើកទី1នឹង5ទៅ10ឆ្នាំចាអរគុណច្រើនមែនតើអញ្ចឹងយើងបន្តសំណួររបស់យើងជាបន្តទៀតចា So doctor, the third question of fat transfer, does it safe?
It's very safe.
Very safe?
It's very safe. It's used. It's done with the help of instruments called cannulas, and cannulas are like a needle but with a blunt tip. And as a result, they don't cut through the tissue. They don't damage nerves. They don't damage blood vessels. They only separate the tissue as we harvest and as we inject the fat. There is a rare complication of fat transfer called fat embolism. I have never had it, but the literature reports rare cases of fat embolism when the fat enters the blood circulation. In that case, it can cause serious damage, but it's a very rare occurrence for fat transfer to cause that. Generally speaking, it's very rare. We put people on antibiotics before the fat transfer, so the chance of getting an infection in the process of transferring fat from one part of the body to the other one is almost non-existent. So far, we have not had any significant complication with our fat transfer cases.
Thank you ចានេះខ្ញុំបានសួរថាតើមានផលប៉ះពាល់អ្វីខ្លះលោកគ្រូពេទ្យក៏បាននិយាយថាផលប៉ះពាល់ហ្នឹងគឺសឹងតែគ្មានតែម្ដងពីព្រោះថាការបូមខ្លាញ់ចេញនិងការចាក់បញ្ចូលខ្លាញ់ចេញចូលទៅក្នុងហ្នឹងគឺធ្វើការបែងចែកជាមួយនឹងជាន់ស្បែកមុខបានស្បែកបានយ៉ាងល្អគឺការចាក់បញ្ចូលក៏ដូចជាការផ្ទេរចេញមកហ្នឹងក៏មានប្រសិទ្ធភាពខ្ពស់ហើយអ្វីដែលសំខាន់គឺមានសុវត្ថិភាពខ្ពស់នៅពេលដែលយើងធ្វើការចាក់បញ្ចូលឬក៏បូមខ្លាញ់ចេញហ្នឹងគឺយើងប្រើអង់ទីប៊ីយោទិកនៅលើខ្លួនរបស់អ្នកជំងឺដូច្នេះហើយការឆ្លងមេរោគហ្នឹងគឺសឹងតែគ្មានទេអញ្ចឹងអាចនិយាយបានថាការនិយាយទៅប្រសិទ្ធភាពក៏ដូចជាការប៉ះពាល់ហ្នឹងគឺគ្មានប្រសិទ្ធភាពក៏ខ្ពស់ចាអរគុណច្រើនតើ